just wanted to apologize because my understanding is that we were actually starting at 6:30, but it looks like it was a 6 o'clock start. So this is really exciting. This is a new topic for me. As you know, I run OWM Integrative Wellness. The integrative is the key word in the title because we're actually integrating multiple modalities to get people healthier and more resilient. And it's not just about the chronic pain or illness. So what I wanted to talk about specifically today is intravenous nutrition and intravenous wellness. This is a growing field. It's been kind of coming out of the shadows for a very long time. There are physicians and practitioners in the country who've been doing intravenous nutrition and medicine for 30 plus years. But it's really coming into its own. I think that everything's improving. We're improving the solutions. We're improving the way that we're introducing these medications. And it's really becoming quite a fine art. What's amazing about it is how flexible and really, really adapted all of this to so many different conditions. You could treat multitude of issues from just staying well to chronic illness. And I just wanted to go through some of those just as an introduction. This is really meant to be a fairly brief, concise introduction to give you a great overview. I have more information on my website for you to take a look at. If you're interested, you can go to OWM Integrative Wellness website and then click on Health Infusions by OWM, and you'll have a list of kind of some of the things that we're doing at our practice. So let me go ahead and get started with the PowerPoint here. Okay. So just to start with, why intravenous nutrition? Well, intravenous nutrition is the best way to get nutrients into the body quickly. You're able to achieve 100% absorption into the cell of anything that you're putting in to correct an imbalance or to optimize a body. The oral supplementations, by contrast, are only giving us about 25% absorption on a good day. And of course, most of us right now in this day and age have some kind of stress, have some kind of inflammation, and it immediately reduces the absorption even further. The other thing is that our foods are more and more depleted day by day. The soil is not as nutrient rich as it used to be in the olden days. We all can relate to the fact that the foods don't taste as good. And again, the reason why they don't taste as good as they used to is because they're not as nutrient rich. So that recommendation of eating, let's say 4 cups of salad or, 8 cups of veggies and fruit a day is still a useful recommendation, but you're getting much less. So more and more now you have to really start to eat beyond that to get those nutrients, which really becomes unfeasible and impossible. And this is kind of what I talk to people in my clinic is that, at some point, like you basically are grazing, you become a grazing animal on pasture, to get your fill, which, again, it just doesn't make any sense. So this is where supplementation truly comes in. It can be done orally, but as I said, you got 25% absorption. So the intravenous is kind of becoming more and more where it's at. So let's go through some of the different areas of where the intravenous applications are very, very useful. So just kind of looking at the categories here, optimization and wellness strategy, again, a huge player in anti-aging strategies, just a general immune boosting for people that are on the go. And then, of course, another great application, which is part of wellness, is beauty. The skin is a huge organ in the body. Some consider it to be the biggest organ in the body. It utilizes a lot of energy to replenish itself and rebuild. And of course, that energy comes from these building blocks of nutrients and minerals that need to be replaced. And again, based on the same concept we just talked about, if you really are not keeping up with this nutrition, if you're a busy person through normal food intake, this is an amazing way to help the skin regenerate. So rapid correction of nutrient imbalances. Okay, this can happen from illness. If you stress, your body's burning nutrients at a much faster rate. Exercise, if you are a hard exerciser, you can actually create inflammation in the body, especially if you are a weekend warrior. We know that that actually creates a lot of stress on the cell, and then reducing that stress can be very beneficial. A cell that is stressed will also burn more minerals and vitamins than a cell that is not stressed. Now, this is different from somebody who's actually a regular exerciser. We know now that if somebody is exercising on a regular basis multiple times a week, they actually are adapted to that exercise-based strain, and they don't tend to get as much inflammation. But for those weekend warriors, if you really killed it, let's say Saturday, Sunday, it's an amazing thing to do, to come in and get an infusion and replenish yourself. So, kind of part of the overall immune boosting strategy, the intravenous nutrition can build resilience. That means that your body can withstand strain, stress, colds, flu. We're coming into the cold and flu season. You want your immune system to be resilient to withstand the viruses that are floating around. So there's your antiviral strategy, and there's also an antibacterial strategy. There are some IVs that, like intravenous ozone or intravenous vitamin C, they can weaken the bacteria, which helps your body then fight those bacteria at a faster rate. An amazing adaptive strategy to facilitate whatever you're already doing. So there's an application for chronic illness. Now, this is a huge band of different diseases. You can go from post-viral syndromes with chronic fatigue. You can go into autoimmune diseases like Crohn's and rheumatoid arthritis. You can go into cancer, all right? And in every one of those, there's an amazing adjunctive assistance that the intravenous nutrition and supplementation can provide to help whatever the mainstream treatment is offering for that condition. So these are typically used as adjuncts to really speed up repair, help the body even respond better to the mainstream treatment. So there's really a hand-in-hand approach for all of these. It just makes the body more resilient, more tolerant to any treatments that are being administered, like for instance with cancer, and just speeds up recovery. So really an amazing option. The other thing, of course, is then chronic illness, you are energy depleted, and I'll talk about that in a little bit. Chronic illness is a constant state of inflammation and stress in the body. Your body's burning fuel like mad, and again, it's not going to keep up. So one of the best ways to keep up with that is intravenous nutrition. And then you can improve function of various organs. There are supplements that have been shown to improve kidney function, supplements that have been shown to improve lung function, brain function. And I'll cover the brain function during this presentation, but just know that there are really, really beautiful ways of optimizing organs overall. So let's move on and talk about the wellness and anti-aging optimization briefly. So just to start with, let's talk about what is aging, because if we're talking about anti-aging, you really need to understand what aging is. And aging is a condition of cellular inefficiency, inflammation, and depletion of essential nutrients and energy molecules. That's really aging, or another word for that is senescence. So as the cell becomes depleted, it's unable to make energy efficiently. There are waste products that are being built up in that cell that it's unable to clear, and eventually it's unable to repair itself. It gets bogged down, and then finally it reaches the state of senescence and then dies. Now, under normal circumstances, that's what's supposed to happen, and these cells get replaced by healthier cells. But as we age, the rate of senescence actually exceeds the rate of replacement of these cells. And that's truly what aging is, right? So it's normal to have an older cell die off and a new cell to come and take its place. But it's not normal for that to happen at a faster rate and at such a rate that your body can't keep up with replacement. This is what leads to breakdown, okay? So So the intravenous infusions are used here to restore low levels of these molecules, and focusing both on energy and molecules and micronutrients, aimed at optimizing the person's state of well-being and function, and keep people functioning well into the older years. So by improving the patient's energy production, you're also allowing the cell to kick out the waste products at a faster rate. So this is what we call cellular efficiency. And the cellular efficiency, again, is a huge part of senescence. When the cell loses that efficiency, it's a huge part of the anti-aging strategy. When the cell is able to regain its efficiency in eliminating waste products, specifically, that process of elimination of waste products is called autophagy. And if you listen to any blogs or podcasts on anti-aging, autophagy is always mentioned because it's such a key part of the cell that we want to maintain in order to prevent accelerated aging. So what about immune system optimization and building resilience? Well, immune system depends on a full tank of really key nutrients like vitamin C, vitamin E, vitamin D, magnesium, the list goes on. And those get repleted and the immune system suffers, right? So as the immune system is not able to dip into these nutrients, as the cells are losing these nutrients, the immune system is not able to respond as quickly to the onslaught of infections, what have you. It also requires regular antioxidants, okay? Again, so these are anti-inflammatory molecules. These are the molecules that scrub inflammatory molecules out of our cells, right? So there's something called reactive oxidative species. These anti-inflammatory molecules, when they're built up, they actually, again, cause a lot of cellular stress and eventually death of that cell. Some of the examples of that are glutathione and alpha-lipoic acid. So as I already mentioned, it is impaired by the inflammation, and of course, reducing inflammation bolsters and boosts the immune system. When inflammation is controlled and cells have a good supply of these molecules, the immune system is resilient and is able to take on infections, as I mentioned before. A nutrient-depleted cell, on the other hand, quickly runs out of ability to create energy and fight off infections. The body will easily succumb to infection, and sometimes that infection is then out of control. So like we understand, let's say with COVID, you may have heard this term cytokine storm that happens. Well, the body doesn't go into this essentially uncontrolled buildup of inflammation. It just revs up until it runs out of these antioxidant molecules. So this is why we always talk about how it's so important for the person to be resilient in the first place. It doesn't matter what infection you're talking about. It's COVID, influenza, herpes virus, who cares, right? It's all about the basis of your immune system. The more resilient your immune system, you will fight off whatever comes its way, okay? So, and of course, again, that's dependent on a full tank of nutrients, minerals, micronutrients, vitamins, antioxidants, okay? So very, very important point that I want to stress here. Let's talk a little bit about the brain optimization. The brain optimization, again, part of aging, okay, part of overall strategy of anti-aging. The brain is always on, okay. We actually have a higher activity in our brain when we sleep than when we're awake. I mean, it burns glucose and at a constant rate, it burns all of those nutrients at an accelerated rate. The more stress you're under, the faster it burns through those molecules. It burns through the same molecules our body does, okay? It burns through antioxidants, it burns through minerals and vitamins. It loses its ability to repair itself and clean out waste products. But in the brain, that actually starts to amount to breakdown in nerve connections. It amounts to an elevation of a stress response in your midbrain. And when your midbrain stress response is heightened, that actually starts to shut down or inhibit your more evolved brain in the prefrontal cortex, where all the creativity, planning, executive function live. And guess what happens? What do people feel when that happens? They're tired. They can't concentrate. They lose focus. They say that they have brain fog, right? Again, it could be from illness. It could be just from running a super busy schedule. All of that could be improved. So again, intravenous, you can do oral supplementation. There's certainly many other ways to help with brain function. In our clinic, we focus a lot on meditation, breath work. We focus a lot on good sleep patterns, elimination of blue light exposure before sleep. But the IV nutrition is kind of like the golden key, right? It kind of gets in there and really does the job very quickly to kind of reset the brain, help it detox a bit. And again, speaking of detox, we talk about detox for the body. We talk in our clinic, we always talk about how it's important to detox, minimum twice a year, but we actually recommend detoxing for every season, right? So 4 times a year. What about the brain? Right? The forgotten organ, the one that runs everything. You got to detox the brain as well. And the AVs and some of these other nutritional strategies that we talk to people about really help there as well. So chronic illness, inflammation is the common currency of chronic illness. There is an accelerated depletion of key nutrients and antioxidants because, again, your body's trying to fight off this chronic illness. It's constantly trying to maintain a balance. But it's a losing battle with chronic illness, and eventually those nutrients are lost. Now, guess what happens when you lose the normal amounts or optimal amounts of these nutrients, microminerals, micronutrients, antioxidants? The chronic illness accelerates. It progresses, right? So sometimes it's not possible to cure chronic illness, but you can delay the progression. You can make it a slower illness. You can make it less impactful, less painful, less draining. Okay, quality of life improves. Right? It's not. Everyone talks about cures, but it's really not always about a cure. There's a lot to be said for quality of life. Right? Extending your quality of life for as many years as possible. Okay, to spend more time with loved ones in the way that you can actually treasure and enjoy them, right? So that is important to understand. The world is not black and white. There is not a cure for everything, unfortunately, but the IVs fit nicely into that kind of understanding in this philosophy that all integrated wellness clinics have is, we may not cure you, but we could sure make your life better for the time that you have. Okay, so something to understand. Okay. So let's talk about some specific examples of infusions. I'll kind of run through them. So immune boosting. Again, we talked about how the infusions can boost your resilience, get you ready for the cold and flu season, help you prevent getting the cold when you're coming off a flight or a long journey. After strenuous exercise, a lot of you guys can probably relate that after you go through a very stressful super stressful period, like a huge exercise event, or college kids coming off a stressful period of finals, they get sick. Why? The immune system was stressed out, colds come in, so these IVs can really prevent that from happening. So it's providing the cell the key ingredients to strengthen the immune resilience, increases energy production, reduces inflammation. And some of the key ingredients are vitamin C, zinc, magnesium, B vitamins, which are major cofactors in the cell for the cell's energy production and overall elimination of waste products, and as well as selenium, which is a huge piece in helping the body get rid of what we call these reactive oxidative species, or these inflammatory molecules. So, what about energy boosting? Well, again, like none of us need that. Again, as we are living more and more stressful lives, we're multitasking, we're tired. What's happening there? Well, we're running out some of the key components that we need to allow our body to make energy at a normal rate that keeps up with our activity level. And Here we start seeing this new element called the amino acids. The amino acids are building blocks of protein, but they're also very important specifically in energy production of the cell. Okay, and one of the big ones is carnitine. We still have vitamin C. You could tell it's a common denominator. Folic acid is a substrate for energy, so that's coming in here. The B vitamins are given, but they're given at a higher rate, right? So a higher amount. B12 vitamins at a higher amounts will create an energy boost that can last for quite a while, right? So we're not only are we playing with the ingredients in the infusions, but we're also playing around with the dosages depending on what the person needs. So tissue repair, well, we're talking about injury or injury prevention, right? So recovery from exercise. This is all about tissue repair. And again, it's all about that ability to repair at a faster rate than the body's breaking down, or in the very least at the same rate. Because guess what happens if you are not able to repair at the same rate as your tissue is breaking down? You are injured, right? There's a tendon tear, there's a ligament tear, whatever it is. There's a joint sprain, back injury. This is how it happens. So, when the body is undergoing physical stress, the tissues require more energy, right? And again, we can help the body supply the energy through intravenous nutrition. There's also greater need for inflammation control. I mentioned how weekend warriors tend to be inflamed. The body's not used to that kind of stress, and when they're put through that stress, just 2 days out of the week, the body goes berserk, right? It's inflamed. It's kind of trying to keep up, try to catch up. So we can help by reducing inflammation and allow the body to catch up after a high activity like that. And again, amino acids are being used up at a faster rate because they're the building blocks of protein, which makes up muscle. And supplying those amino acids back into the body is an amazing way of preventing injury and improving recovery. And the picture, you see this injection into the knee under ultrasound. I do quite a few of those. So this is an example where somebody, let's say, has an arthritic knee. And again, just the process of arthritis alone means that the body's breakdown has exceeded the body's ability to repair. And then we'll go in and do a procedure. And this procedure will actually help the body repair itself. But again, what's happening when you stimulate the body to try to repair, it needs even more of those building blocks. So what we do during these procedures is we give people an intravenous infusion of these amino acids, antioxidants, so that it can grab them quickly and utilize them for repairing, to help repair the joint and help that solution that we're putting in to provide that repair. It's a very, very cool way of doing that. So now moving on from conditions, I want to talk about just some of these very key ingredients that kind of stand alone and really deserve separate mention. NAD. NAD is a molecule that's essential to life. It's involved in multiple areas of energy production in the cell. It's key in cell genetic material repair. By the way, if the genes are not repaired at a regular rate, again, you have cell death. It's key in optimal brain function. The brain, as I mentioned, utilizes energy like crazy, and therefore there's a lot more opportunity for breakdown. It needs that repair. It needs an AD for that. NAD is involved in multiple cycles of the energy loop, both in the cell and in the mitochondria. Okay, so when we use it for all of these conditions that we talked about. We'll use it in anti-aging to keep people optimal. Okay, we'll use it for chronic illness because guess what goes away with chronic illness? NAD starts to become depleted. That doesn't go away completely, but it's diminished, and the cell starts to struggle. Neurodegenerative diseases like Parkinson's, talk about enhanced rate of uptake and utilization of these key ingredients. Well, something that has a neurodegenerative process going on, like multiple sclerosis or Parkinson's, goes through those particles at a much faster rate, including NAD. So when we give NAD, it slows it down, it stabilizes it. Again, it's quality of life. And there's also a very special place for NAD in addiction, pain, and I forgot to mention even depression and anxiety. It's an interesting side note on depression and anxiety is that you guys are all familiar with a hormone called serotonin, which is our feel-good hormone. This is in a short supply in folks with depression and anxiety. That's why people get serotonin reuptake inhibitors, right, to increase the pools of serotonin in the body. But what a lot of people don't know is that when the body's struggling to keep up with stress, because the NAD molecule is so essential to life, it always comes first. The body, instead of making serotonin, will make NAD. So there's a precursor called tryptophan, and that tryptophan has a choice to make. It can either make serotonin or it can make NAD. Well, guess what? If NAD is in short supply, it's going to be diverted for NAD. Guess what happens? Now you have low serotonin, now you got depression. So this is one of the ways that helps, is that if we replenish NAD stores and the body can then concentrate on converting tryptophan to serotonin, you feel better. Right? So, interesting pathway. So, ozone, just an amazing, amazing molecule. There are a lot of applications. It's been used in this country for over 30 years. One of the key anti-aging strategies is a ozone IV infusion. And the way it's done, as you can see in the picture, it's actually done by infusing the ozone into a bag of blood. Okay, so it's not injected into the body. As soon as it is injected into the bag of blood that's pulled out of you at the time of the procedure, it becomes something called lipoperoxide. And this lipoperoxide does some amazing things. And when it enters back into the body through an infusion, it improves energy, improves cellular health, resilience of the cell, reduces inflammation. It can have some antiviral and antibacterial properties. So just a multitude of benefits. Okay, it is definitely one of the best ways to increase oxygen extraction by tissues of the oxygen traveling in the blood as it's coursing through our body. And this is something that we know we lose. This is another aspect of aging. Again, it's accelerated in illness. And this is an ability to extract oxygen with each pass. So as your blood pumps once, the blood it's sending out oxygen-rich blood. It's coursing through the arteries, rather, and the arteries are sending it through all your tissues and organs. And those tissues and organs are grabbing it as it's passing through. The more they can grab, the healthier they are, right? Because oxygen is, of course, essential, right? The less they can grab, the more inflamed and weaker and unhealthier they are. And as we age, starting from age 30 or so, it's a precipitous fall, okay? And IV ozone has been shown to actually kind of plateau and improve that to a great degree. Huge part of illness treatment and anti-aging. It improves circulation in the brain. Again, great for concentration, great for chronic neurological conditions, powerful reducer of inflammation. It can also modulate the immune system. So for people that have autoimmune conditions, it will reduce the immune attack on the body, and it will actually enhance the protective side of the immune system that makes you more resilient. What a wonderful thing to have, right? So based on all the things I've described, you could see it has a wide application from anti-aging to chronic illness and everything in between. IV glutathione, again, really kind of making quite a name for itself. You know, a lot of infusion facilities are offering that, and there's a good reason. It is considered to be the most powerful antioxidant in the body that the body makes, okay? It makes a lot of reactions happen in the cell. It scrubs these reactive oxygen species and recycles other nutrients like vitamin C. And it's huge in detoxification, right? So we need to get rid of waste products through our liver, and it's essential for that process. So it's frequently given at the end of all their IVs to enhance their function because it has so many uses, and it's just an amazing, wonderful molecule. So Alpha lipoic acid, again, not as well known, but really quite an amazing molecule that is instrumental in so many vital functions of the body. It is also a potent antioxidant. It kind of works hand in hand with glutathione. It also helps recycle key vitamins like vitamin C. It's effective in detoxification pathways, and it helps with nerve repair. We give this a lot to people with nerve pain. By the way, it's also been shown in multiple studies to stabilize glucose metabolism, right? So it decreases insulin resistance, helps diabetics get their sugars under control, and therefore it can actually help with weight loss. So again, you could see how many different uses one molecule can have. And so again, very commonly used after many other IVs as a complement. Okay. So vitamin C, last but not least, probably one of the most amazing molecules out there. It is, again, essential in our energy production. It's a potent antioxidant. It boosts our immune system and helps us make more energy. It just makes the world go round, and we can't make it. Just as a kind of a fun fact, the only two mammals on this face of the earth that cannot make their own vitamin C are guinea pigs and humans. It's kind of interesting. Not sure what the connection is. But because we can't make it, we have to get it from foods. Because the foods are more nutrient depleted, it's harder and harder to do that. There's an interesting fact that a lot of our citrus fruit is shipped frozen, or at least in the cold enough temperature that it actually causes crystal formation in the fruit before it gets to the store. And this is frequently how you can explain some of the softness and kind of sponginess of the citrus fruit sometimes you'll find in stores. Well, if you see that, there's no vitamin C left. Okay, the ice particles destroy the vitamin C molecule. It's depleted, right? So this is what's happening all over the world. How do you deal with that? Well, obviously fresh fruits and vegetables, and then again, intravenous or oral supplementation becomes very important. It also has this very interesting function that in characteristic, where in low doses it's very much an immune booster, and then and an anti-inflammatory. But in high doses, we're talking about 15 grams and above, it could be a potent antiviral. It can actually work along chemotherapy to either weaken or kill cancer cells. And again, one of the ways that it's thought that it does that is that it is its molecular structure is very, very similar to a glucose molecule, to a sugar molecule. And cancer is very, very sugar hungry. So it mistakes vitamin C for glucose and gobbles it up. But cancer cells, because they're growing so fast, their internal cellular mechanism is different from our human cell. They do not have an ability to break down that vitamin C to get rid of inflammation and to make energy. And it actually either weakens that cancer cell or actually destroys it, right? So we'll use vitamin C as an adjunct with cancer, again, along with traditional methods, right, like radiation or chemotherapy. It can also protect from some of the chemo and radiation damage, and it helps people tolerate chemo and radiation better because the cells are more resilient. Amazing, right? So let's see what else we got here. Okay, a couple of other items. IV peptides, definitely cutting edge, a little bit newer. They are, I gotta say, mostly used either through intramuscular injections or through subcutaneous injections, but there are a couple that can be used intravenously. Some of them can boost your immune system. Those are derived from the thymus gland. And some can be utilized to, let's say, improve cognition, reduce brain inflammation. One of them is called cerebrolysin, and that can be used to really improve brain health and promote brain repair. So speaking of that, the last one I want to quickly mention is IV ketamine. Ketamine is a FDA-approved drug for anxiety and depression. Currently, it's only FDA-approved as a nasal spray, however, although many facilities are finding that IV ketamine seems to be a little bit more efficacious. And that still seems to be the preference. So how does it work? Well, it blocks this very special receptor in the brain called an NMDA receptor. This is a receptor that releases calcium and glutamate, and those are our stress hormones. These are the stress peptides, actually, and they're flowing through the cell, and they allow transmission of stress signals, pain signals. They drive anxiety, they drive depression, they drive pain, and again, they potentiate this state of fight or flight, right? So again, this is a state where our bodies are totally in kind of life preservation mode, even though that's not always where we are. I mean, there's literally nothing attacking us about to kill us, but the chronicity of stress or chronic illness or trauma puts our brain in that state, and we can't get out of it, okay? The midbrain is so powerful. It's such a primitive structure in the brain. It's so hardwired that it overwhelms the rest of the nervous system. It shuts down your prefrontal cortex. Again, you start to lose focus, mental flexibility, creativity, pleasure, right, in life. All of those start to become reduced. And ketamine has been shown to reverse some of these processes, so when it's given over in a drip over 40 minutes, it starts to shut down to that NMDA receptor. It weakens that midbrain, it weakens the fight or flight response. It allows the prefrontal cortex to come back online. It facilitates in detoxing of the brain, in reduction of inflammation. It has been shown and proven to have new nerve connection growth within 24 hours of ketamine exposure, which is amazing. So it is, again, I believe, a wonderful, wonderful intravenous molecule that can really improve a person's quality of life in so many different ways. So that covers my quick kind of tour de force, so to speak, of the intravenous nutrition. If you guys are curious about learning more about this method of wellness or treatment of illness, again, my website is a wonderful resource. Certainly happy to answer questions if you email us or call us as well. And I want to thank you guys for turning out and listening in. I wish you guys a great evening. You guys all stay well out there, okay? Thanks for watching.